everyone. So today I'll be talking about my third semester in medical school, that is second year. So obviously in this semester also we focus mainly on our theoretical subjects that are anatomy, physiology, histology, biochemistry, and we also have immunology, pathology, microbiology. There are many subjects, but then these are like the main major subjects that we focus on. When we're talking about anatomy, physiology, and histology, this time we mainly focused on the brain, eyes, our facial muscles, and nerves, cranial bones. So these were very important and interesting topics. And in biochemistry, this subject is very important because in this we study about the enzymes, the hormones that are making our body function, and how these hormones are making our emotions show on our face, or how we react to certain things. Obviously, you know that when you touch a hot surface, even without thinking, you first take out your hand, or you have a reaction, you have a reflex. So why do we have a reflex? We studied that. So these are very interesting and very important foundation subjects that are going to help us further when we have different subjects that are going to be more advanced, but their foundation will be with these subjects. Then we come to the subjects that are very interesting and new in this semester. I would say in second year we did clinical skills 2. Last time I talked about clinical skills 1, in which we did more theoretical thing, that is history taking and patient communication. So what happens in, you have obviously experienced this as people in society, that when you go to a clinic, when you visit a doctor's office, first thing they ask you a list of questions about what are you feeling, how did this happen, about your lifestyle, about your illness, about what have you had like for breakfast, or like about food, about your habits. So that was a practical theoretical thing, that was history taking. But in this year we did clinical skills 2, in that was purely practical subject. In this practical we did so many things, like we did catheter, we did injections, we did cannula, we did gastric tubes. So obviously you guys know what a catheter is. We did so how to insert a catheter, how to remove a catheter. There is a whole process for every part. We did the whole process in written, then we used to memorize it, and how we carry out this process. That means that when it starts from the beginning, when you enter the room, we have to knock and get the patient's confirmation, patient's permission to enter. Then we have to get their informed consent. We have to inform the patient about all the procedures that will happen, or suggestions about the processes that we are thinking about doing. So in all these, when we were learning about injections or cannula, when we were learning about them, so our professor, our doctor is teaching us how to talk, how to communicate with your patient, so the patient is not in an anxious feeling, is not scared of the process. Because I have encountered many people that are very scared of needles. So as you can see, this is a cannula. So what a cannula is, basically cannulas are used to draw blood, or like give medications. So it's intravenous. So it will cannulas are inserted directly into your vein. So when we did cannula in catheter, we learned male and female. So there is a bit of a difference, because obviously there is male and reproductive part and female reproductive part, which is widely different from each other. So there is a bit difference in how we administer the catheter. But other than that, the process is same and the instructions are clear. But in injections, this time we learned intravenous, subcutaneous, Yeah, and subdermal. So intravenous is directly into the veins. Subdermal is in the skin, and subcutaneous is also in the skin, but in subdermal it's so we have different degrees in which the injection is inserted. So in subdermal and subcutaneous, we have a lower angle of the needle. So when we are inserting, wait, I'll show you. So take this is a needle. So I will okay. So when you are injecting, the angles are very important. So if it is directly into the veins, so we have to palpate the vein, and after the degrees are important because it will be 10 to 15 degrees. Or when we are inserting medication directly into the forearm, then it will be either 45-degree or directly 90-degree. So that is important. And yeah, so we studied about the three types of injections. And in cannula, so this is your cannula. This comes in different sizes. So we have this, and we also have a smaller size. We have many sizes back in the practical room. But when we're inserting cannula, we learn about the whole process and how to insert, how to remove. So that was a very interesting topic, and we did it. We did a practical. We practiced a lot, and we learned about nasogastrial tube, oxygen tubes, how to insert a urine bag, and yeah. So that was the most interesting part of this semester and year, to do practicals and have a first-hand experience, a clinical experience. Although it was on dummies and we are still learning, we did sutures. It was very nerve-wracking but interesting to do all these things for the first time. And other subjects that are not the main subjects, but we have research skills. That is, research skills is very, very important in all the fields, but especially in scientific fields and medicine, where there is new innovation and new discoveries on a daily basis. So as students, we have to learn about all the research skills, how to gather research, how to draw up your own research paper, how to write, how to understand, how to read a research paper. So that was very interesting, and our professor is a very elderly lady who had an immense amount of knowledge. So that was interesting to study. And the other subjects are electives. In my university, we can take with our main subjects, we can take our elective subjects that is going to help in our course. So our elective subjects this time I took was sociology of medicine and telemedicine and medical tourism. So sociology of medicine is basically when you combine the society and medical field into one. We saw this when the COVID struck our society, and in that pandemic, how the society and the medical whole came together to cure something and help everyone. So public health and society comes in sociology of medicine. We learn about a lot of things and about a lot of public health. And in telemedicine and tourism, we basically learned about how telemedicine is coming in our society now, new age in time, where we can sit at home and on a video call we can interact with a medical professional and gain their understanding. Because what happens that in a busy life nowadays, we cannot always make time to go to the doctors. So you can have appointments now on video calls, and you can contact them on phone to have a consultation. It's majorly focusing nowadays on mental health and small consultations. And in medical tourism, it is a big new not new, but a very rising phenomenon around the world. As in medical tourism, we studied that every country nowadays have focused on medical tourism a lot, because it is having an immense effect on their economy, and on their economy, and also on to advertise themselves to the world. As we know about the main examples that I can think of top of my head is Turkey. Obviously, Turkey. When we hear about Turkey nowadays, the picturesque cities don't come in mind, but the hairline surgeries come in mind. The hair transplant. It is famous for its hair transplant. When we think about East Asian countries, that's South Korea, China, for the plastic surgeries, cosmetic procedures, cosmetology, and many foreigners even come to our India to have their own surgeries done. Chennai is famous for having foreigners come and do their surgeries. For eye specialty, for dental work, people go to different countries to go get specific care. So that comes in medical tourism, and it is a whole new world out there for that. And in this there is also wellness and wellness tourism, which is like mainly when people go to different places to take a breather, to have wellness, to focus on the whole body and mind together. So these places, especially in Georgia, they are famous for their spas and their mineral water, their mineral resources. Finland is famous for their saunas, and in we have Himalayas, Himalayan tourism, Black Sea, Blackwater tourism. So these all come in our medical tourism and telemedicine. So yes, these are the main subjects that I studied in this semester, and it was very interesting. And thank you so much for being here and listening to my conversation. But thank you so much. Have a nice day.